can stress affect my skin? And of course, when I'm seeing patients in clinic as well, I often see that if they're talking about stressful events in their life, whether it's family related, whether it's work related, we see that effect on the skin. And how do we see that? Well, you may present with itchy skin, dry skin, flare-ups of things like eczema, dermatitis, psoriasis. Chronic skin conditions can flare up all the time, and that's generally stress related. Hello and welcome to another edition of the Vysana newsletter. I'm Dr. Sunny Dhesi, and today we have some exciting hints and tips about immunity, skin. As always, we're talking about mindfulness, menopause or hormone related health, and of course medicine. So please, if you haven't already, click on subscribe if you're watching on this YouTube. If you're not on YouTube right now, head over to YouTube, search for Vysana Life, and give us a like, leave comments, and also click the little bell for notifications so that you can get notified every week when we do share our newsletter with you. A question we get asked a lot in clinic is, can stress affect my skin? And of course, when I'm seeing patients in clinic as well, I often see that if they're talking about stressful events in their life, whether it's family related, whether it's work related, we see that effect on the skin. And how do we see that? Well, you may present with itchy skin, dry skin, flare-ups of things like eczema, dermatitis, psoriasis. Chronic skin conditions can flare up all the time, and that's generally stress related. So why is that? Well, one of the key components of stress is a hormone called cortisol. When you're under stress, you get increased levels of cortisol, so prolonged levels of cortisol. And this can then lead to chronic levels of inflammation in the body. And that inflammation then leads to those problems that we see in the skin. One of the ways, obviously, to tackle stress is to practice meditation or mindset, which we discuss a lot in clinic with patients. But also sometimes you need a little bit of a helping hand. And that's where we come in with targeted, bespoke skincare solutions. So for example, we have our Made of More range, which has a CBD balm cleanser. CBD is known to reduce inflammation in the skin. It also has an antimicrobial effect. And we also have other products from the likes of a Abaji or a Lumiere, where there are peptide-rich skincare products that help to nourish and nurture the skin. So stress is a significant problem. It's something that can be underlying. You don't really recognize that you're seeing it. For those of you who have experienced anxiety, that is a kind of more focused or concentrated form of stress. And of course, there are ways of tackling it. So yes, the answer is stress can affect your skin, and then it can lead to prolonged problems and exacerbation or worsening of existing skin conditions. Now, moving on to hormonal health. So this is usually a difficult time of the year. As the nights are getting longer, there's less sunlight. We've spoken about vitamin D in the past. Lack of vitamin D, lack of sunlight, lack of activity and exercise. This can all lead to problems with the skin. And how does that present in clinic? Well, we are seeing increased accelerated levels of aging. Whereas in the summer, there's a lot of sunlight, that you're more active. Skin is generally in a better condition. It's plumper, it's got more resilience to it, it has a better skin mantle, there's less water loss as long as you're protecting it from the sun. But as we come into the autumn and the winter, what we're seeing is waking up in the morning saying, well, I look much more older, my lines are much deeper, my skin is sagging, I'm seeing volume loss that I didn't see before, jowling, and how do we tackle those problems? Well, injectables is a good solution, but it doesn't always have to be dermal fillers. Dermal fillers are great at replacing volume where volume has been lost. However, there are other products like skin boosters in the form of polynucleotides or Profilo. So if you are waking up in the morning and finding that actually, what I've kind of put off, sort of investing in my skin during the summer, and now I'm seeing the effects of that lack of investment, give us a shout, give us a call. You can have virtual consultations, you can have online consultations, and we can create a more bespoke solution for you. Remember, it doesn't always have to be injectables. We do have a machine in clinic as well called the Venus Versa that has radio frequency and IPL to tackle pigmentation. So in summary, those problems such as volume loss, skin aging, lines and wrinkles, those can be easily treated. But as always, we look at the underlying cause as well. And obviously I've just mentioned about stress, but we look at the underlying potential physiological and medical causes, which are usually hormonal or can be due to chronic conditions related to aging. Last but not least, now, as you know, I do work in the NHS as a GP. I'm also a private GP as well, and now we're bringing those services into clinic. But what is the importance of it? So what? Why do I need to have regular health checkups? Why do I need to be investing more in my health? That's entirely up to you. But what I do notice is that, one, it's always difficult to get an appointment in the NHS. We deal with that on a weekly basis when I am working in the NHS. However, what do we offer in clinic? Well, a lot of questions get asked during our aesthetic consultations, and I'm always going to deliver value and answer those questions. But now we have virtual GP consultations for 30 minutes or an hour, or we have face-to-face consultations as well. And these are little things like that I've picked up that may sort of pique your interest. So, for example, I looked at some blood results for a patient who'd been having annual, actually private regular health checks, and we were discussing their glucose levels and what we call their HbA1c, which is a marker for diabetic disease. And what we noticed is that for the past 2 years during their annual health checkup, their HbA1c, which is a marker for pre-diabetes, had been running high consistently. Now, how does that manifest for the patient? It means that they're gaining weight, they're feeling tired, they're lethargic. Now, because it's in the normal range, nothing was really said. It was just commented that your HbA1c is in the normal range. However, the consequence of that is that the patient is still getting symptoms, like I said, of tiredness, lethargy, weight gain. And what actually is a problem is that they are creeping more and more into that diabetic range, and it needs to be tackled head on. So although your bloods might be in a normal range, it doesn't necessarily mean that's normal for you. So what does our private consultation hold? It means looking at your blood results, if you do the blood test with us, of course, in more detail, providing a more bespoke and targeted solution to your health concerns, and overall, that more holistic care. That local kind of GP, family orientated, holistic look at your health. And that's what we're trying to offer here at Vysana. So if you are interested, please do book in via the consultation tab, or ring the phone number, or email us at information@vysana.com. So that's the end of the newsletter for this week. I hope it's been informative. As always, we are going to say that we're doing a free webinar next week on Wednesday at 7:30, and we're going to be tackling those sniffles, those colds. Why do I keep getting unwell? What is going on with my immune system? Am I allergic to something, or is it that my immune system isn't as primed or as good as it should be? So please sign up to the link that we've shared with this newsletter. And as always, if you haven't signed up on YouTube, please give us a follow and click that bell as well, so that you get the notifications when we share this newsletter. I'm Dr. Sunny Dhesi. This is Vysana Life, Vysana Clinic, Vysana, and we are here for you, for your health needs, your skin needs, and your mindset needs as well. Thank you.